We will now be demonstrating a patient performing quadriceps contractions with the Kneehab device in the weight-bearing posture. These basic exercises will involve the patient performing quadricep contractions with the knee in or near full extension or the fully straightened position. These are the basic ways to begin to strengthen the muscle under the weight of the body for functional strengthening. For the level 1 exercise performed in stance, the patient stands with even weight on each leg. When the contraction of the device is felt to come on, the patient squeezes their quadricep muscle with that contraction and holds it for the duration of the contraction. When the device releases, the patient relaxes and still stands evenly on both legs. There is no need to increase the weight shifted onto the affected leg during these contractions. Even body weight should be maintained throughout this exercise. The level 2 exercise in standing is a quadricep contraction that brings the knee from a slight bend into a fully straightened position against the resistance of a band. The band is fixed around the back of the knee and tied off at a sturdy table leg or shut into a door. If a pad is needed for comfort behind the knee, please do so. When the contraction of the device comes on, the patient pulls the knee back straight against the resistance of the band and holds for the duration of the contraction. When the contraction on the device releases, the patient also relaxes, allowing the knee to sag into a slight bend. The heel may come off the floor slightly. When the next contraction comes on, the patient squeezes the knee back straight, pressing the heel down against the ground as the knee extended position is held. This series is repeated with the timing of the contractions on the device. For the level 3 exercise in stance, the patient will shift the body weight over onto one leg with the onset of the contraction from the device and squeeze their quadricep muscle along with the device. When the contraction from the device releases, the patient places the foot back down and shifts back to even body weight. They repeat this cycle of shifting over onto the one leg and squeezing with the contraction of the device and shifting back over to even stance during the rest cycle. A chair may be used for balance support. For the level 4 exercise in stance, the patient sinks into a slight amount of knee flexion, as in a ready position or a slight crouch. The amount of knee bend should be comfortable for the patient. When the contraction of the device is felt to come on, the patient weight shifts over onto the leg with the Kneehab device and squeezes their quadricep, maintaining that slight bend at the knee. When the contraction releases, the patient places the opposite foot down and returns to even weight bearing. The knees may be extended briefly before the next contraction cycle begins. Again, the patient's in slight flexion, shifting the body weight over and squeezing with the device when the contraction is felt to come on. The knee is maintained in flexion. Please use a chair or a countertop for balance support.